This is an overview of the nervous system. The human nervous system is divided into the central nervous system and the peripheral nervous system. The central nervous system and the peripheral nervous system integrate sensory information and control motor and cognitive function. The central nervous system contains the brain and the spinal cord. The peripheral nervous system is divided into two subsections, the somatic and autonomic nervous systems. The somatic nervous system has nerve cells that carry information to and from the central nervous system. It produces sensations and voluntary movements. The autonomic nervous system has involuntary and subconscious activities. The nerve cell is the basic unit of the nervous system. It consists of a cell body, axon, and dendrites. The nervous system is an extraordinarily complex communication system that can send and receive voluminous amounts of information simultaneously. However, the system is vulnerable to diseases and injuries. Now we're going to talk about the definition and basic overview of addiction. Addiction is defined as a chronic, relapsing brain disease that is characterized by compulsive drug seeking and use, despite harmful consequences. Drugs can change how the brain looks and functions. People begin taking drugs for a variety of reasons, such as to feel good, to feel better, to do better, and curiosity. Most abused drugs produce feelings of intense pleasure. Some people who suffer from anxiety and social disorders abuse drugs in an attempt to try and lessen the feelings of distress. Others may abuse drugs because they feel pressure to improve their cognitive or athletic performance. Adolescents are particularly vulnerable to abusing drugs because of string influence from their peers. People can have certain risk factors that increase their chances of addiction, such as aggressive behavior in childhood, lack of parental supervision, poor social skills, drug experimentation, availability of drugs at school, and community poverty. On the other hand, there are protective factors such as good self-control, parental monitoring and support, positive relationships, academic competence, school anti-drug policies, and neighborhood pride, which can reduce a person's risk of addiction. Other factors that can increase risk of addiction include early use of drugs. Drugs have a harmful effect on the developing brain, and the earlier a person begins drug use, the more likely he or she is to develop serious problems. Another factor is method of administration. Smoking a drug or injecting it into veins increases its addiction potential. Both of these methods allow the drug to enter the brain within seconds. Risk of drug abuse increases greatly during times of transition.
Now we're going to go into addiction and how it happens and how it affects the nervous system. When drugs are taken, the chemicals in them hijack the dopamine reward system, which creates the euphoric feeling of drugs. The dopamine reward system is the system in our brain which releases dopamine after a behavior has been done. Behaviors that are normally associated with this system are eating and sex because these behaviors are essential to human life and population. The euphoria that is produced when drugs of abuse are taken is so strong that drug abusers chase this feeling, and after a while of using, they need the drug just to feel normal. Addiction starts with drug abuse, then leads to drug dependence, which leads to the terrible spiral that is addiction. The reason that drugs alter the way we think and the things we do is because they disrupt neurotransmission. The chemicals in drugs mimic neurotransmitters, and when they're taken, these chemicals bind to the receptors that neurotransmitters should be binding to. This process can either elicit a response or inhibit a response.
Dopamine is a neurotransmitter that plays a key role in mood, motivation, and drive, desire, and pleasure. This has earned dopamine the distinction of being labeled the feel-good chemical, but other neurotransmitters can also have a pleasure-reward effect. When some drugs of abuse are taken, they can release 2 to 10 times the amount of dopamine that natural rewards such as eating and sex do. This occurs almost immediately, as when drugs are smoked or injected, and the effects can last much longer than those produced by natural rewards. This motivates people to take drugs again and again. Drugs are chemicals that affect the brain by tapping into its communication system and interfering with the way neurons normally send, receive, and process information. Chronic exposure to drugs of abuse disrupts the way critical brain structures interact to control and inhibit behaviors related to drug use. Just as continued abuse may lead to tolerance or need for higher dosages to produce an effect, it may also lead to addiction.
Non-drug or behavioral addictions have become increasingly documented in clinic settings, and pathologies include compulsive activities such as shopping, eating, exercising, sexual behavior, and gambling. Like drug addiction, non-drug addictions manifest in symptoms including craving, impaired control over the behavior, tolerance, withdrawal, and high rates of relapse. Now defining symptoms and treatments, the early stages of drug abuse are characterized by tolerance to a drug, which can lead to eventual dependence. Tolerance produces excess drug use, which increases risk of dependence. Heavy drug use also causes deficiencies in nutrition, withdrawal symptoms, and extreme behavior while attempting to acquire drugs. Now talking about treatments for drug abuse, a cognitive behavioral perspective on treatment attends to the underlying short-term problems of dysfunctional and negative thinking that is common in those who abuse drugs. Behavioral therapy and medications are used to suppress withdrawal symptoms. Also, long-term treatment in the form of cognitive behavioral therapy focuses on underlying negative thought patterns. Furthermore, the epidemiology and history of drug abuse and addiction in the U.S. has been consistently shown through survey to have peaked in the late 70s, followed by an overall decline in the 1980s, and then a rise again in the 1990s. Since the mid to late 90s, drug use has either declined or remained stable.
One of the hardest things for drug addicts is withdrawal and withdrawal symptoms. Withdrawal is when someone who has been using a drug is not using the drug anymore. The severity of these symptoms depends on different factors. Many factors, including level of dependency, length using the drug, and the type of drug used. There are many symptoms of withdrawal, and they depend on which type of drug is used. Some general symptoms that are usually associated with withdrawal are anxiety, insomnia, headache, nausea, vomiting, fatigue, muscle aches, loss of appetite, and panic attacks.
Lastly, we're going to discuss the impacts that drug addiction has on society. There can be negative effects of prenatal drug exposure on infants and children if a mother is addicted to drugs, such as heroin or prescription drugs, that can cause withdrawal symptoms in the baby once born. That can be called neonatal abstinence syndrome, and some children can have developmental disabilities such as behavior, attention, and thinking. Another impact can be secondhand smoke, which that exposure increases the risk of heart disease and lung cancer in people who have never smoked by 25 to 30%. A third impact can be increased spread of infectious disease. Drugs like heroin, cocaine, and meth currently account for about 12% of new AIDS cases. And injection drugs also could potentially cause liver disease. All drugs interfere with judgment and increases the likelihood of risky sexual behaviors, which contributes to the spread of HIV and AIDS, hepatitis B and C, and other STIs. Other impacts include increased medical expenses and early deaths, crime and social disorders, and cost of treatment for drug control.